Hi, welcome to the COVID-19 Lake Norman and North Mecklenburg briefing call. Today is Wednesday, April 29th. Where did April go? My name is John Bradford. I am your briefing call moderator. I'm a small business owner. I have two businesses right here in North Mecklenburg, Park Avenue Properties and Pet Screening. And I'm also a former member of the North Carolina House of Representatives, and it's my pleasure to bring you these series of calls. The purpose of these calls is to bring together healthcare experts, government officials, and business leaders to provide regular COVID-19 briefings to update, educate, and support the North Mecklenburg region during the outbreak. So Trump announced a social distancing requirement through April 30th. So April 30th is almost upon us. So we'll see if that gets extended. But as you can see from this screen in front of you, social distancing can help flatten the curve. So please exercise those. You're seeing retailers have floors marked now under one of the latest executive orders. So social distancing, let's continue to take it seriously and do our part to help stop the chain of infection growing exponentially. President Trump, the White House, and CDC, of course, have guidelines now for opening up America again. These guidelines, it's a three-phased approach based on the advice of public health experts. The steps are going to help state and local officials when reopening their economies, getting people back to work, and continuing to protect American lives. One thing that's new is the CDC just released guidance for cleaning and disinfecting public spaces, workplaces, businesses, schools, and homes. So if you go to the CDC website, you can actually download a plan so that if your business, if you start to reopen, you can develop a plan, then implement your plan, and then maintain and revise. I think we're hearing a lot of questions about liability and, am I culpable as a business owner if we're an essential business? Our employees come in and they get sick, and I think it's important for business owners and other places of work and schools and even at home just to practice good guidance and for cleaning and disinfecting. And so this is a way to do that by developing a plan, implementing it, and then maintaining and revising it. So this is something that's new on the CD website, and so I just wanted to point that out to all of you today. The face cloth coverings are still being recommended. So if you need some face cloth coverings, there is a company called Indira Mills, shop.indiramills.com. It's a 3-ply cotton face covering. It's reusable. I have some. They're very comfortable to wear when you're in stores. $2 a mask. You have to order 12 dozen minimum plus the cost of shipping. And you can also call them, but the website is probably the quickest. And that is a North Carolina-based company. So hope you'll support them if you need face coverings to help slow the spread of COVID-19. We have a new heat map. They've added some colors. The CDC has a heat map. We're at 981,000 total cases. This is really as of yesterday, so this is a little bit old data, but this is the most recent data available for this call. We have 55,000 deaths across the U.S. of all of our jurisdictions, and they've added some more colors to the heat map. So you can see they've added some very dark purples and then some lighter purples and then a series of oranges. And as you can see, North Carolina, we're definitely not the most impacted states. Florida, it looks like Texas, California, New York, even Michigan, some of those states are the most impacted. North Carolina is very similar with Tennessee and South Carolina. So that's good to see. Our neighbor to the north, Virginia, looks like they're a little more impacted than North Carolina. So, we look to be in pretty good shape compared to some of our neighbors. But I thought it was interesting that they've added some new colors to give us a new scale. So just wanted to share that with you. The FEMA Rumor Control site, great place to go to find new rumors. There are no rumors from the last call that we had, but this is a friendly reminder that rumors are out there. Check the FEMA website. Do not be scammed. No one can give you money. If you are owed money from the stimulus check, the stimulus programs, the checks, hear from the government, IRS knows who you are, the Department of Treasury, they know who you are. Do not give your information away. So just please check the FEMA control website. North Carolina is still under a state of emergency. We know that's been extended through May 8th. We'll talk about it in a few minutes, but there's a hotline here, and you can also use your phone and use 211 for texting. So if you need that, this is all right here on your screen. These numbers just came out for North Carolina. We're at 9,948 laboratory confirmed cases. 354 deaths. That is up from Monday, just 2 days ago. We were at 306 deaths, so it has climbed a little bit. In terms of hospitalization, we were at 473 hospitalized on Monday, and we're now up to 551. And the number of counties, we were at 95 on Monday, and we are now at 98 counties as of today. There are 100 counties here in North Carolina. Here's a map of it, and there's only 2 counties left out of the 100 that don't have some kind of reported impact. But before this is done, chances are all 100 will have impact. As we talked about last call, grades K through 12, North Carolina public schools have closed for the remainder of the 2019-20 academic year. Now, that's the actual school buildings that are remaining closed, but some of the schools are still having remote learning. So please note that remote learning is still ongoing, but the actual school buildings are not going to be opening up per the governor's order. And there is a new grading system that's been implemented for elementary school, middle school, and high school. So please work with your school administrators to understand those grading systems. But that's all something that was announced last week, and just want to continue to share that with you. So on Monday's call, I talked about us being in phase 1, but I've since learned that really phase 1 isn't going to start until, I guess, May the 8th, at least as of current. But phase 1, I look at these things in phase 1, and I don't see really how those are any different than what we're doing now. So I guess that deserves a deeper dive when we get to officially phase 1. So I guess we are in phase 0 right now. In other words, we haven't even got to phase 1 yet. But eventually we're going to get to phase 1 May the 8th. And when we get to May 8th, phase 1 will be here. And as you can see, phase 1 is it looks to be almost exactly what we're doing now. So I guess we're going to learn what the differences are when we get there. I'll be happy to try to find some more details. But I thought we were in phase 1 because it seemed like that's exactly the things we're doing. But nonetheless, phase 1 technically will start May 8th. Now, once we get through phase 1, whenever that's determined that we're done with phase 1, then we're going to move to phase 2. And phase 2 will be at least a couple of weeks after phase 1. And now the stay-at-home order will be lifted with strong encouragement for vulnerable populations to stay home. Now I would start to see some differences here. Phase 2 is going to be much different than what we see today, and I guess will be much different than phase 1. But that's really, so my goal is let's see us get to phase 2. I want to see us get there because that means we're going to start being able to get back to some sort of normalcy. So hopefully we can get to phase 2 soon. But stay tuned. We have to go through phase 1 first to get there. And then after phase 2, we'll have phase 3, and that'll be at least 4 to 6 weeks after the start of phase 2. So obviously these phases are going to take us through the summertime, it looks like. And of course, phase 3 will even be more reduced restrictions for vulnerable population, or lessened restrictions for the vulnerable populations, but still encouragement to practice physical social distancing, etc. So again, 3 phases coming. Stay tuned. If you're a healthcare volunteer or if you're a healthcare person and you want to volunteer, please go to this website. North Carolina Department of Health and Human Services could use your help. And if you are unemployed, or if you're an employer and you have questions about unemployment, you can go to this website, des.nc.gov, for questions. I know they've had a lot of volume, so be patient, but these are 2 places to either volunteer or seek benefits for unemployment. In terms of Mecklenburg County, based on their website right before we started this call, 1,528 positive cases with 45 deaths. And tomorrow, Mecklenburg County stay-at-home restrictions are going to time out. And now they're going to transition to the state stay-at-home order. I think that's a very good thing because there was a lot of confusion because the county's orders were more restrictive in some areas than the state's orders. So this is going to bring will be exact parity with the state. So again, Mecklenburg County stay-at-home order restrictions are going to time out after today. So starting tomorrow, they will transition to the state stay-at-home order. We do have a question about boat ramps and things, so I don't know the answer beginning tomorrow if Mecklenburg County Parks are going to open to vehicles. I don't know that answer yet, but as of today, Mecklenburg County Parks are still closed to vehicle traffic, but walk-in and bike traffic is permissible. But with tomorrow, Mecklenburg County moving to what the state is doing, I'd be curious. I'm curious to learn and find out, and maybe Commissioner Cotham can help us with that. We're going to find out if those parks are going to open to vehicular traffic beginning tomorrow. So I guess we'll find out. Visit Lake Norman, before I get into our panelists here, Visit Lake Norman has this really cool virtual tip jar. They have 144 service workers that are in rotation. They've had over 109 clicks with a 71% tip ratio. And every time you visit the website, there's someone new featured. Now, the other thing Visit Lake Norman has done, and this is really cool, folks, is they've created this streaming Lake Norman. So they have coloring pages. So for children, they have images of Lake Norman that they've changed to black and white, and you can download these, and your kids can color them in, which is pretty cool. And for all of you that are doing Zoom calls, whether it be social Zoom calls or work Zoom calls, they have created some of our favorite Lake Norman pictures as possible screenshots for Lake Norman. And so let me show you some of these. And this shot is a picture, of course, of one of the marinas. You can use this as your background Zoom image, which is pretty neat. Here's another one of cherry blossoms in one of the coves on Lake Norman. Here's one of a pier on Lake Norman. And then lastly, Brewster's Ice Cream, everyone's favorite, I know, one of the favorite ice cream of the Lake Norman area. This is a picture of Brewster. So all of these could be your Zoom background. You can download these at Visit Lake Norman. So I think that's pretty neat. So moving into our panelists, Congressman Greg Murphy, a Davidson College alumnus. He represents the 3rd District. He's also a medical doctor. He cannot be with us today, but I always just want to thank him. He's been a mainstay of our calls. On Wednesdays, we are joined by the U.S. Small Business Administration North Carolina Director, Thomas A. Stith III. He's been a wonderful resource. I know he's with us today, and I know they've been very busy. Director Stith, we'd love to hear an update from you on what's going on at the SBA.
John, I appreciate the opportunity to come on again today, and again, your leadership is much appreciated. I thought I could give a brief update on the Paycheck Protection Program that has relaunched into version 2.0, and then talk a little bit about some of the adjustments that we see in the initiative. This information is going to be dated because it was what we had the results from last evening, so we know it's an ongoing process. But as of in the day on yesterday, nationally, there were 475,000 PPP loans. 5,000 lenders had participated, over $52 billion already committed. The new allocation was $310 billion. One of the adjustments in the new Paycheck Protection loan legislation was to have a designation of $60 billion divided in 2 ways. One, a $30 billion allocation for banks that have assets under $10 billion, and then another designation of $30 billion for banks between $10 billion and $50 billion in assets. The thought with that designation within this new allocation was to address some of the concerns from the first round of smaller businesses having access to capital and to these loans. And by designating to these different asset class banks, the thought was there would be more diversity in applications. Smaller community banks would have a more dedicated pool to receive approval from SBA. That proved correct. The $10 billion and below institutions exhausted their funding on yesterday. The $10 billion to $50 billion had allocated about $10 billion as of the end of the day yesterday. That does not mean that those smaller asset banks cannot continue to participate. They will now participate as in supplying applications on first come, first served to the larger pool. As of yesterday, 85% of the loans were $150,000 and lower, as comparison to the first round, where 75% of the loans were 150 or below. So we're starting to see that there are a larger pool of smaller loans being approved. The average loan for round 2 so far is $110,000. In the first round, it was $207,000. So again, we're seeing a trend, at least in the early stages, that we are seeing a more diverse distribution of funding. One of the announcements in both Treasury and a joint announcement between U.S. Treasury Department and SBA also announced that in a continuing effort to ensure that these funds and resources are reaching the intended small business, that any loans over $2 million would be reviewed to ensure that guidelines were followed. And I wanted to talk just a little bit about that. The The regulations and guidance around that are still, we are waiting to get the official guidance, but we currently have a Q&A posted on the SBA website, a national SBA website, sba.gov. And I would just encourage, while the final regulations are being developed between Treasury and SBA, to point individual businesses to question number 31. And it gives guidance around what borrowers should think through to ensure that they are certifying themselves as, or properly as, qualified for these loans. And literally within that guidance, it says borrowers still must certify in good faith that their PPP loan is necessary. Specifically, before submitting a PPP application, all borrowers should review carefully the required certification that current economic uncertainty makes these loans necessary to request and support an ongoing application. Borrowers must certify in good faith that, taking into account their current business activity and their access to other sources of liquidity sufficient to support their ongoing operations in the manner do not substantially, significantly, or cause detriment to their business. In other words, while we are asking Treasury and SBA in question 31 in our FAQs, they really are asking, obviously the business have to self-certify that they are eligible, but they need to have a real consistent look to see if there are other assets or other access to capital, as we've seen with some of the larger media stories. Those individual businesses had other access to capital and really did not meet the definition of that self-certification. So specific guidance is forthcoming, but I thought it was important to share that, one, that $2 million loan would trigger a review by Treasury and SBA. Specific guidance is moving forward, but I would direct small businesses now to look at question 31 on the FAQs that is posted on the website to get guidance at this point. So John, in conclusion, we're seeing a robust response to round 2 of funding, which was anticipated. The economic injury disaster loan received additional $60 billion of funding, $10 billion for additional funding for the advanced component, $50 billion for the full economic injury disaster loan. Currently, because of the initial limited funding and response, SBA is reviewing and processing applications that were submitted before this new round of funding, and we will be getting guidance for any new applications. But if individual small businesses have submitted their application, they're being reviewed and will be funded if approved based on new funding that was just recently passed. So, John, I know a lot of new information, but I thought those couple of points were very important as small businesses engage in this new round of funding.
Yes, Director Stith, that was very helpful information. I've had several questions regarding the details, especially the larger companies. So your directive to go look at those Q&As, especially question 31, I think will be well received. So thank you. Appreciate your leadership in North Carolina. You probably don't get thanked enough. So let me take the opportunity to thank you, because I know you're in high demand, and all the folks that support you, thank them as well. So we appreciate you being a panelist every Wednesday, and we look forward to hearing from you next Wednesday as well.
Thank you so much, John. I look forward to talking again next week.
That sounds good. Thanks again. So now we're going to move to, we have a local medical doctor, Dr. Jack Faircloth. I like to refer to him as Dr. Jack. He's with us today. Love to hear from you, sir.
Okay, thanks, John. I appreciate this opportunity to be here, and thank you for moderating and leading this. It's really brief today. The main points will be that the CDC did loosen their criteria for testing again as of Monday. I'll go over that. Secondly, it looks like the capacity for testing is much greater than what healthcare is using, and that has recently come to light as companies that test, Quest, for instance, or LabCorp, many academic places have notified us and said, hey, we can test with greater capacity, so I'll touch on that. I'll give the 2 phone numbers for how a patient can call and get a test. And then lastly, just touching on where we are with the big 3 that healthcare needs to provide, which are vaccines, treatments, and testing. I'll give an update of just where we are as of today. So first, I said the CDC came out on Monday and said that its priority for testing has loosened. It's now added asymptomatic patients at the discretion of the clinician or public health authority. They are not still considered the highest priority, such as first responders or healthcare workers or those that reside in long-term facilities or those with high-risk conditions. Those are considered top-tier high risk. But for the first time in this entire pandemic, the CDC has now left it up to the doctor's discretion to test asymptomatic patients. So that this may really help the return to work movement if employees can get tested. Next, I mentioned the data on the ability of testing is better than the number of tests that we're running, and that's true. It looks like information from the Rockefeller Foundation says that as of this week, we tested 1.5 million patients in the U.S. Lab capacity to test was at 3 million. And so we are looking to rise to that number. What's keeping that those 2 numbers from not being congruent is the fact that we did have to ration tests to the point that doctors are still in the mindset that you don't want to waste your tests. But the CDC is helping. The lab companies themselves are contacting healthcare systems. And basically, we need to begin to loosen our restrictions and our thinking about having testing as they ramp up availability. The return to work look for Mecklenburg looks like mid-May. We're not sure, roughly when this side or that side of mid-May, but it's definitely the consensus is that the return to work is going to have to be staged and it will have to be managed. That's the only consensus that we have at the moment. We know nationally major corporations like Amazon and GM are looking into getting their own antibody and diagnostic tests in order to get their workers back to work. So we expect local businesses may try this. There may be corporate testing sites that pop up in office buildings or nearby facilities that provide occupational health or primary care assistance to help our local businesses get patients back to work. In lieu of testing, right now businesses can and should strongly consider spacing out, using masks, deep cleaning. I'm glad you mentioned the CDC guidelines on cleaning parameters. They deep clean on a regular basis, and even consider having employees sign off on questionnaires saying that they feel well as soon as 2 hours prior to starting a shift. Makes scientific sense that can go a long way in helping reduce the spread. So before, employers were restricted in acquiring private information like that, but during a pandemic, it looks like that'll be a possibility. And last, for COVID testing options, there are 2 phone numbers that patients can call in addition to contacting the doctor. So Atrium's phone number is 704-468-8888. As of today, results at Atrium come back in 4 hours. Mainly, occasionally they come back the next day. And their false negative rate, as well as Novant's false negative rate, is very low on diagnostic testing. Novant's phone number is 877-966-8268. Novant has some limited 15-minute turnaround testing. Mainly, it's going to be a matter of a day or the next day. In summary, patients, continued social distancing, healthcare really lacks the big 3 that we need to get back to normal. There's a lot of vaccines in research. That's one of the big 3. It looks like 12 to 18 months is going to be a hard and fast rule on those. There's a few places like Oxford that are saying maybe as early as fall they'd have this new DNA technology-based vaccine that could be out for emergency use. But honestly, that is the first time ever in the history of medicine type technology, so I wouldn't bank on that. Number two, the second of the big three is we need definite treatments. Our healthcare facilities here are doing wonderful. As of today, we have 128 total inpatients in the Atrium Healthcare System throughout the state. So our numbers are low, our death rates are low, but we don't have a specific treatment. So we're given mainly supportive care. Last of the big three is unlimited testing. I mentioned on that we're at 1.5 million tests a week. We could easily go to 3 million tests this week with better coordination of testing. And hopefully we get to increase those numbers as private availability of testing comes around, and employers can really, and patients can really take control of this. That's all I have today. Thank you. That's it.
Hey, John, I think
I'm sorry, guys. I'm sorry, guys. I was on mute. I thought you were on mute. I was on mute. I'm so sorry. I am now, I was thanking Dr. Faircloth. Now let's move to Mecklenburg County Commissioner Pat Cotham. Sorry about that, guys.
Oh, well, thank you. And John, you made my day. I love it when younger people forget things and get mixed up. So
it's happening more often.
You'll appreciate that in the years to come. But thank you again for inviting me. I always enjoy listening to everyone. Yeah, so we had our meeting, our policy meeting yesterday. It started off with a update from Congresswoman Adams about some federal issues that were happening. But the big surprise was, Dina just announced that we had heard inklings of it, but that she announced that we would all, go forward together, the towns and the county, with the governor's rule, and our county rule would end. So I thought that was, good news, and I was glad that we were moving forward together. I was surprised that my colleagues most of them were not happy, and they made it very clear. And I felt to me, it was kind of awkward, and I did not like some of the things I heard them say. So when it was my turn to speak, I thanked the towns and thanked them for staying with us as long as they had, and that we were glad we were moving forward. But it was just kind of uncomfortable. So hopefully, I think maybe some of them were not expecting it, and so they were maybe caught off guard. But it was just kind of awkward. Tomorrow the parks will be open, and I have learned, and I know Mayor Annarella has a lot more information about this because she's been involved in the order, but it will be open to vehicular traffic beginning at 6 o'clock in the morning. So I did confirm that when we just started the phone call. So that's good, and I hope we can, the use of the parks will help a lot of families and get people more exercise. And I kind of want to talk about some of the concerns that have come up in the last 24 hours in the newspaper. There was a big story about concern about, did we start early enough with the county and the emergency management group? And the article seemed to, imply that we hadn't. Hindsight's always 20/20. But I said, and I just want to reiterate that, and I said in the article that this was, another glaring example of why the county needs an official board of health. Since I got on the board in 2012, I realized quickly that the board of health had been changed from years before, and it was changed prior to my coming on the board. And the commissioners were the Board of Health. They were also the Board of Social Services. And I thought that was not in the best interest of the people. And I know some of my colleagues who are no longer on the board were in agreement with that. And I think that this is another example of that we need to have, maybe some retired physicians. We have several universities in the area. There's got to be some professors of public health that might be in the area that could help us, or an epidemiologist, somebody that could help us with these, so we could get some better information and have some more, get some more advice. But I have been talking about this since 2012, and I will continue to talk about it because we have had several big. This is certainly the biggest problem we've had, but we've had some other serious problems since I've been on the board with health. One of them was the whitewater Naegleria problem, where a young woman died. And then we had the hepatitis outbreak at a fast food restaurant on Interstate 85. And then we had the pap smear problem at the health department. And during those times, it would have been so helpful for the county commissioners if we would have had some better advice from people with high expertise, but we did not. And even our health director, is not a physician. And, for a while there, a couple of years ago, we had like one physician at the whole health department. And so it's better now. But those are things that I just want to speaking broadly, I have tried to get more support for a board of health, a real board of health, but I have a feeling that it'll be on my gravestone that we need a board of health, that it's not going to happen. So I just wanted to put that out there again so that you could think about it. And there was also some negative feedback on our county manager about the business roundtable she started. And we knew she was going to start this, and I think they had a telephone conversation, and but there was a pushback that it wasn't a public meeting, and I heard from some groups in Raleigh that contacted me about it, but the manager was like, her response was, we're working, we can analyze, do a post-mortem on this process later, but right now we're trying to save lives. So I hope that she does expand it and make it more public. But that was just the first call, but there certainly was some pushback on that. And let's see, I think I'm looking at my notes. We did start yesterday hearing from some groups that we support. Mainly it was Central Piedmont and the court system. And the court system is really under the state, but the state doesn't do what we think they should. So we always supplement them. And we also do more at Central Piedmont, just like it's at CMS, then we are obligated to. And so they presented their what they wanted. The manager is going to make her budget presentation on Friday, and I believe it's at 11 o'clock. So that'll probably be on the on the news. It'll be live streamed. So we certainly, and the manager has told the groups that they can kind of expect a flat. A flat response from us, because we're not going to have extra money, and because the revenues are decreasing tremendously. So, but I understand that groups still want to tell us what they want, but I'm sure they know they're not going to get that because the funding is just not there, and we've had extra expenses, But anyway, so that'll be on Friday. And then we'll probably get heavier into the budget debate in the weeks ahead as we continue with these virus presentations. But anyway, that's about all I have from Mecklenburg County.
Okay.
Thank you for letting me give you an
Thank you.
update.
You bet. Thank you, and sorry for the audio error earlier. So now I want to go to Cornelius Mayor Woody Washam. He has a time clock issue. He's got to go to another call. So Woody, give us the express version, sir.
You got it. Thank you, John. We had some pretty bad news in our community with the autumn care situation here. I got caught off guard, as everybody in our town did. Folks are upset. I don't quite understand why it had to be that way, but I wasn't much help in getting them through that, particularly with all the calls I was getting, because I didn't know either. I learned it in the media like everybody else. So I hope we can think about that and figure out better ways on the autumn care type setting that goes on. So anyway, that's been a huge thing I've had to deal with, particularly with my citizens. They've reached out in pretty great numbers. The other things that I will say, and I'm sure John Anarella will cover it, is that I'm very pleased about the change in our stay-at-home ordinance here in Mecklenburg County. It was a little bit of a heavy lift on behalf of the mayors in the county, but we worked hard at it. I think it was the right decision for everybody related to our businesses as well as individuals. I think we can make this happen as long as folks will abide by this order and, keep their distance and wear masks. So I'm very hopeful that happens. Other thing quickly is our coffee chat is Monday. I think Deputy Manager Heron told you that on Monday. It is Monday at 8:30. It's going to be a great presentation featuring our county manager and other town officials. Also, we'll be kicking off Small Business Week. If there's ever a time that our small businesses needed to be celebrated, it is now. So you'll hear all that Monday at 8:30. The Zoom link will be out on our town website. If you need it, reach out to me, and I'll be glad to provide that for you. Thanks, everybody, and sorry I have to jump off here.
We understand. Thank you, Mayor. And now we're going to go to Huntersville Mayor John Anarella. Before I turn it over, I just want to make a comment. There was an article in the paper, and I feel like the mayor was taking really a lot of pressure for something that I believe he was standing up for, and I think showed exceptional leadership, in my opinion. That's a purely editorial comment on my part, but I do want to give credit where credit's due. So, Mayor, great to have you today. I'd love to hear an update from you, sir.
Hey, thanks, John, and thank you for hosting this. Wow. I think people can see that tomorrow will be a much better day in Mecklenburg County from a lot of different businesses' standpoint. So whereas over the last 30 days, a business may have been closed here and been allowed to be opened someplace else in the state, that business now, for the most part, will be able to be opened. And just to give you a little sense of some of the businesses, electronic retailers that sell cell phones, computers, tablets, lawn and garden equipment retailers, bookstores that sell educational materials, religious facilities, as long as it's less than 10 people, then real estate, realtors, it's going to be a little easier to to conduct business, and automobile dealers. And then something that, is really happening, tragically, people die every day, and they're in Mecklenburg County. You only could have 10 family and friends, and as of tomorrow, you'll have at least up to 50. So hopefully that would help with some of the healing process that occurs. But I want to also talk about the retailers that have been closed. Basically can open now, and I'm going to read from the order. It says establishments not otherwise identified as essential in the executive order are permitted to resume conducting business, but must be online or telephonic sales with delivery or curbside pickup only, and provided that the establishment complies with the other conditions that are in the governor's order. So if you've been closed, you can ramp up your social media and tell people you're open, and hopefully start getting some sales going. We will see what happens with the governor on the 8th or 9th of May. So we're hoping that we'll have some type of opening at that time, but that will be up to the governor. So I think it's a great first step to getting our economies moving. And in terms of the parks, as you heard, you can drive to a park now or tomorrow that's run by Mecklenburg County, play tennis at all the parks throughout the county tomorrow. Just bring 2 sets of 2 cans of balls so you don't mix those up. And boat ramps will be open, and Joe Gibbs Racing will be open. So NASCAR's coming back, and we'll have something to watch and something else to do besides catch up on our binge watching. So that's really all I have, and I appreciate the support that we could galvanize throughout the county to at least cut down on the confusion that's really hurt a lot of our businesses and took up a lot of our time. If you have any question about the new order, the number to call would be 704-353-1926. And then if for some reason you think your business still needs a waiver, I would contact the North Carolina Department of Revenue and follow their process to gain a waiver. That's all I have, John.
Yeah, thank you, Mayor. And just for clarity, if you're one of those businesses that has a DOR waiver, but you weren't able to open because of the more restrictive order in Mecklenburg, tomorrow that time's out, which means now your DOR revenue or your Department of Revenue waiver will now be applicable, and you'll be considered essential effective tomorrow. So that will really help. So thanks again, Mayor. Now we have moving to Davidson, Town Commissioner Matthew Fort, who's joined us on a couple of these calls. Commissioner Fort, love to hear from you, sir.
Thank you for having us on. We had last night our town board meeting where we had the Mecklenburg County manager and our public health person on, and I would ask you to go check out the YouTube of that. We had a lot of good questions for the both of them, and I really appreciate them coming out or coming online and speaking to us and taking the time to answer our questions after clearly a very, very busy day that they had. And again, that was Dina and Dr. Harris were both on last night for us, for our Mecklenburg County Public Health Director and our Mecklenburg County Manager. No other real updates for us. We are seeking feedback. We have received a request from the Davidson Community Foundation for a $50,000 grant to help our local citizens and residents. And so there'll be a survey that goes out, and I just encourage everybody to weigh in, whether they feel strongly for it or against it, and let your voice be heard. And that's all I have.
That's great. That's great. Hey, Commissioner Fort, do you know, will Fisher Farms open up now that the county is going to parity? I know they maintain Fisher Farms to vehicles, so will you guys do the same, do you know, tomorrow at 6 a.m.?
Yeah, we're all rowing in the same direction and
okay. Very good. Good, very good. A lot of mountain bikers would be happy to hear that. Drive their cars out there and get back to riding. So thanks for joining, Commissioner Fort. We appreciate you. Now moving to the CEO of the Lake Norman Chamber of Commerce, a real mainstay in our community and a mainstay on this series of briefing calls, Mr. Bill Russell. Love to hear from you, sir.
John, I think this has probably been the most informative, and I think you've been doing this for now at least 5 weeks?
Yeah, it's been several. I've lost count. Lots of them.
We've been doing this for quite a while, and this may be the most informative call because there has been a lot of stuff happening just within the last 24 hours. I wanted to echo something that you just said. All of our leaders, elected leaders, are under tremendous pressure, and again, this is unprecedented. But I want to applaud their leadership. But I want to echo something that you said. John Anarella, Mayor Anarella, Town Manager Anthony Roberts, they're standing up for business. I want to applaud that, thank them for doing that, and continuing to push our county toward re-engaging our business community, because that's so important. We need to be safe, but we need to get back to work. And one of the things that the Chamber of Commerce has done is we've placed a couple of things on our website at lakenormanchamber.org. The first of which is from the United States Chamber of Commerce, called Responsible Reentry, that really discusses what businesses need to be doing from phase 1, phase 2, and phase 3 that's been introduced by the Trump administration. So I encourage you to go to the website again, responsible reentry about what all the businesses can do. The second thing that we did is we placed on our website, Open for Business, a blueprint for shopping safe. This is specifically for retailers, and this was information put together by several very prominent national retail organizations. Again, it is a blueprint for shopping safe. So if you're a retail organization, whether you're a member of the Lake Norman Chamber of Commerce or not, I encourage you to go to our website at lakenormanchamber.org to see about how you can be re-engaging in our business community. The Chamber has organized an economic task force. We're going to be reaching out specifically to those retail businesses that will be allowed to open up and find out who is opening. Just because they have the opportunity doesn't mean they're going to open. So we're going to find out who's opening, what hours, what are the conditions they're opening under. The second thing we're going to be doing is looking to our banks. Even though the PPP is out there with a fourth rendition, and we talked to Senator Tillis last Friday, there may even be a fifth rendition of that coming down the pike. We want to find out what kind of low interest loans are out there for our business community from our banks, and so we're going to get that out, as well as cleaning companies and cleaning supplies, because it's going to be extremely important that these businesses, when they open up, create a safe environment, not just for the customers and clients that may come in, but for their employees as well. So that's another thing that's extremely important. Mayor Washam just talked about National Small Business Week. It was originally slated for this coming week, the 4th through the 11th. Now with the pandemic, the United States Small Business Administration has kind of kicked that event down the road. They don't even know when they're going to hold it. But we as a Chamber of Commerce are going to begin next week, May 4th, begin having activities all virtual for our small business community. So you're going to see that, some seminars and some events of that nature. And then we're extremely excited. Right now, we're putting together a heck of a week, the week following May 11th. We had originally planned for that small business event that we have every year with the nationally renowned speakers. We're going to have 3 powerful motivational speakers on Monday the 11th, Tuesday the 12th, and on the 13th. This is going to be a program that we put together with WSIC, which broadcasts from Statesville to Huntersville. These speakers are going to be phenomenal. We have 2 guys that we were bringing back, Chuck Gallagher and Steve Gilliland, who were the keynotes from last year and the year before, as well as a female that we're going to announce. Again, it's going to be a fantastic program. And we're following that up on Thursday with a program of selling in the new norm. We know that sales is going to be different as we are getting back to work than it was before we entered into this pandemic. So we've got some exciting programs for small businesses over the next couple of weeks. We encourage you to go to our website at lakenormanchamber.org. If you don't know much about the Chamber of Commerce, our Chamber of Commerce, we have 850 members that are from Huntersville, Davidson, and Cornelius, and the greater Lake Norman region. So again, we have those programs lined up. I want to thank everyone who has continued to support our restaurants that are open. There is a complete compendium of all of the restaurants in Cornelius, Davidson, and Huntersville on the Visit Lake Norman site. And we also have our chamber member restaurants, their hours of operation on our website at lakenormanchamber.org. Again, thank everybody for continuing to go out there and support them. And again, as I say every time, John, thank you so much for putting this together. This is really a one-stop shop. Every Monday, Wednesday, and Friday, people know that they can go to get the most up-to-date information, not only impacting business and commerce, but our community and our state. So, John, thank you so very, very much for putting these briefings together.
You bet, and thanks for your leadership and all those very, very important updates. We appreciate you. So just moving along, if you are in Huntersville and you're a member of their chamber, there could be some helpful information on their website. So I just wanted to share that with you. We've had an open invite to them to join our calls. They have not accepted that invite, but most certainly we do want to share that that's another resource here locally. Let's see, briefing panelists, just want to thank everybody that has been a part of these calls. Could not do it without them. That's all I'll say. And I was just looking, we've been doing these for 6 weeks, 3 days a week. I mean, trying to bring you the most updated information. We'll do another call on Friday, May 1st. So May will be upon us. And if you have questions and concerns, you can email lkntogether@gmail.com. We are stronger together, lkntogether@gmail.com. Please take care of yourself, take care of each other. This does conclude today's briefing. Thank you for listening.